going. So let me hit record. All right, so tonight we are going to talk about learners with physical disabilities and other health impairments. And then we're going to do a little bit about the other end of the spectrum and talk about students who are also identified as gifted and talented. Those are students we call as twice exceptional, where they may have a special education disability, but also qualify as a gifted and talented student. These are all the things we'll go through when we're looking at the different physical disabilities and other health impairs. Pretty much the same thing we've gone through with all of the disabilities, just kind of the prevalence, some education considerations, and what are some of the disorders in early intervention. So if we look at this and we talk about the definition and the classification of physical limitations or health problems, right? So they can interfere with school attendance to such the extent that they require, special services. So some things could be anomalies present at birth, cerebral palsy, loss of limbs, right? Any students in wheelchairs, anything like that when you think about physical therapy or physical disabilities. It could be due to an acute or illness or a condition. It could be something that's ongoing. It could be episodic, meaning it happens here and there, but it occurs frequently. And some are also progressive conditions, right? Some ones that become more serious over time. Oops, too far. Oops. I think I'm going the wrong way. Hold on. No, I'm good. Okay. So about 1% of our school age population have physical disabilities. Sometimes I feel like it seems like it's more, but it's really only about 1%. About 75,000 of them have orthopedic disabilities. The majority of everybody else is usually some other health problem, some chronic illness, things like that. There has been an increase in identification, and that's because, again, just like everything else, we've gotten better at identifying things. And of course, the medical field has definitely improved. So we see a lot of advances that individuals that have these severe disabilities, maybe long time ago, maybe even before my time, didn't have a good prognosis, but now they do because of, how well we've advanced medically over the years, right? So if we look at CP or cerebral palsy, right? So you have all probably seen students or individuals with cerebral palsy. It's that disorder of movement and posture, right? So it's a brain injury before, during, or shortly after birth. So it's something that happened, after either before, during, or after the child was born. So there are some extremities involved. Sorry about that. You'll see a quadrilepgia. Yeah. Okay. Quadrilepgia or paraplegia. I can't say that. I have a speech impediment tonight, guys. So, students with cerebral palsy, sometimes their bodies are kind of contorted. They may be in a wheelchair, their hands are kind of turned in, things like that. And their movements are very rigid and tough, and they're hard. They are associated with disabilities in the fact that there's a high proportion from other disabilities, but most of students who are CP actually have a full range of intelligence, right? So we have some that are perfect, have great IQs and normal intelligent. They just have this physical disability, all the way down to some who have CP who are nonverbal. I have a couple who are nonverbal in two of my elementary schools. I mean, the two girls are cute as buttons, but they're nonverbal. So their abilities, it's affected them. They have other things going on besides just the CP. But one of them did take some steps the other day, and that was really exciting for us all on our own. So we were pretty excited. So another disorder would be epilepsy, right? So that's more of a health disorder. If you guys have all seen, or I don't know if you've seen, but individuals having seizures, right? That's that electrical energy in the brain cells. It's a chronic condition. It happens very frequently. And seizures vary, right? The duration, the frequency, the onset, movements. One seizure is one seizure. Some students will kind of almost just space out, and they're having a seizure and you never know. All the way to, I think it's grand mal seizures, where there's a lot of convulsing and they're on the floor and there's whole whole other things that go on. But seizures have a wide range, just like any other disability. But epilepsy is in many different forms. Not all individuals who have epilepsy have any other disability. That's it. And it is the seizures and things like that that are causing some issues. And it is primarily a medical condition, right? It's not a physical disability. It's not a learning disability. It's truly a medical condition. Most students who have epilepsy will have health plans. And what do we do when a seizure happens? So everybody in the school knows how to handle it. They may have EpiPens, all of those things, whatever they need to combat it. But everybody who works with a student with epilepsy should be trained in what to do. I haven't had many students with epilepsy. Mr. Hurley, have you?
I've had quite a few.
Yeah.
So yeah, and I still do. I have a couple of students now with epilepsy and having to monitor them and a seizure care plan and how to, record it and the frequency, and who to contact and medical, what do we have to do if we have to administer certain medications. We all have to be trained on that. We have to sign off on saying that we were trained through the nurse, getting permission from the doctors, from the parents. There's a lot to it.
And it's very scary the first time you ever see a student or an individual have a seizure if you've never seen that. I give you a little story. My daughter, when she was a baby, had a seizure as a reaction from a really high fever. So fortunately, I had seen them enough but when you're holding I think she might have been like not even 2 years old at the time. It's scary. It's scary to see that. So if you do have students that have that, it is scary, but it's something you just got to remember to remain calm with. But we do have students that have that. So then the next one is the orthopedic and the skeletal disorders, right? So MD, muscular dystrophy. I think that's what you guys probably don't know who he is, Jerry Lewis. Is that like before everybody's time? Anyway, he had that, but it's hereditary, it's progressive weakness, and it's really what happens is the muscles start to degenerate. So they start to lose muscle tone and muscle function. It's very hard. Rheumatoid arthritis. There is this thing called juvenile rheumatoid arthritis. A lot of adults will have rheumatoid arthritis, but their muscles and joints are affected. So they have a lot of pain, like in their fingers, and anywhere there's a joint, there's a tremendous amount of pain for them. Scoliosis. That's that curvature of the spine. I know when I was younger, in school, the nurses always checked for scoliosis. We had to bend over and they had to check your back. I don't even know if they do. I don't think they do that anymore. I don't know. But I know back in my day, which, I was born in the 70s. So that was a long time. When I was in elementary school, we had to do it. But again, with these things, these medical conditions, these muscular things, often at times, intelligence is completely unaffected, right? They are, again, just pure physical disabilities, not necessarily anything with intellect or cognitive ability. It's just, physical. But you will often see students like this in self-contained classrooms, not because of the intellectual disability, but because of the level of care that they require during a school day. So they may need a class like Mr. Hurley's, who has staff trained and a lot of paraprofessionals and things like that, just for the medical issue of it all. Some students may have one-on-one aids or things like that, depending on the severity. So some other conditions, you have, either other health or physical. Asthma, you can have a student who has significant asthma that has problems. Cystic fibrosis, that's another, I guess I would call it, I guess it is a disease, illness that really impacts. There used to be a lot of way back when HIV and AIDS. I think it's still out there, just not as much as there used to be. Fetal alcohol syndrome, that's pretty big. And then, of course, just medically fragile kids who've had complications, or parents have had complications during birth, things like that. Those are other conditions, other health that would cause a child to qualify as an other health impaired student, or OHI. So what are some, prevention of physical disabilities? Well, we can try and minimize as much as possible accidents. Moms and families cannot do substance abuse, unhealthy practices, teenage pregnancy. That tends to be a cause. Child abuse. You have a lot of students who have traumatic brain injury or things like that and end up with physical disabilities because of that. And improper treatment. So maybe malnourishment, not following a correct diet, things like that. All of those are preventative strategies that can be done to prevent some of these things, these other medical issues. So I want you, Mr. Hurley, if you actually would throw this in the chat, I want you guys to watch this video. It's about four or 5 minutes. It's actually a really cool video on mannequins and how they made mannequins with individuals with disabilities. So it's pretty cool. So let's take a few minutes to watch it and then we'll kind of come back and talk about it.
I don't have access to it, so I can't cut and paste it.
Oh, okay, hold on. I'll put it in the chat for y'all. Oh, I guess it is in the slide, isn't it? I didn't get the whole thing. There you go. I guess that bottom part didn't. Are you able to link it or do I need to repaste it? It must be good.
Can you redo it? I can't get it. It just went to like that
Yeah.
Huffington Post website.
I can. Oh, it's still doing that. There we go. Thanks, Mr. Hurley. My copying skills were not that great tonight, y'all. Sorry, it's been a long day. I was in a meeting from 9 o'clock till 4 o'clock today. It's been a long day. think you guys should be about wrapping up watching it. I think we should be about good. Everybody should have had a chance. But as you've watched this, so obviously one of our goals, I thought that was just really cool to see how they made those mannequins as individual disabilities. I've yet to see that anywhere in any stores. But I think it would be amazing to see that. I think that's great. But obviously one of our goals of working with students who are physically disabled is really to educate the non-disabled population about their needs. So just unmute yourself or in the chat, tell us one way the individuals in the videos address this goal. So what's one thing they did to educate the non-disabled population about the others? Yeah, showed visually what they can look like. Really what they look like, right? That was the most obvious, is that they showed other. And did you see, yeah, put them in in the window, different individual. Not everybody looks the same. They're trying to normalize it. Absolutely. Did you, what were your thoughts when you saw some of the people that looked by the window? Like, what would your reaction be if you saw that? If you walked by a store window and saw, you know, someone with CP, that, you know, the obviously where she was sitting in the chair, or the girl with scoliosis where she was kind of, you know, her back was really kind of distorted. What would you think if you walked by a store and saw that? Happy there was inclusion? Maybe what would you think before you took this class? Yeah, Maggie, I agree. I think it would be cool to see. I would love to see it somewhere. Absolutely. Yeah. Yeah, absolutely, Lisa. I mean, you think about it, that these folks don't often see models or statues or things like that that look like them. So they probably do feel like they're left out. I think the fact that the designer spent so much time, it looked like, just talking to them and measuring and making sure it was just perfect. I'm sure I can assume that there was a lot of conversation and things like that. So maybe he's helping to educate other people. Yeah, it definitely caught their attention. Some of the faces were like, huh. But you saw the smiles when the individual saw their mannequin. I just thought that was really cool. Really cool video. So let's talk about, you know, again, with our goal being how to educate. So what are some ways a teacher could address this goal? So what are some things you guys could do in your future classrooms if you have a student with a physical disability? Again, you can either put it in the chat or feel free to unmute yourself and say something. But what are some things that you guys think you'll do or can do? Picture books. Yep, books. There's a lot of books out there now. Heck, I think there's Barbies now with disabilities. I think there's a Barbie out there in a wheelchair. Visuals, helpful videos. Yeah, art on the walls. Research projects, more inclusion in TV shows. I agree. Amen. Yeah. So these are huge. Books are great. Stories are great. Conversations. You can have guest speakers come in. You know, if you have a career day, I mean, there are lots of individuals with physical disabilities who are extremely successful. seek one out, ask them to come in, or maybe you'll be fortunate enough to have a parent or somebody like that can come in. But the more we can educate our students, the better. And the more, like somebody said before, we can normalize this for those individuals who do have the physical disabilities. And you guys saw from your ADA projects that sometimes it's not very easy for them, especially if they're in wheelchairs, to navigate around. What was that one? Was it the Tiger store, or that one store that I feel like kind of a lot of people wrote about that appeared to be awful for people with physical disabilities? I'm gonna have to go check it out. So some psychological and behavior. Oops. Hey, there's my team. Can you see the slideshow again? Sorry about that. Can you see the slideshow again? Are we good? Okay, thanks, Israel. So some other things to consider is the academic achievement. Again, it's going to be extremely varied among individuals with physical or other health impairment. Especially if it's an other health impairment and it's a medical issue, they can have very erratic school attendance. Often at times, students like this, we may recommend the parents seek out a medical homebound form from their doctor, and we provide some services at home depending on it. I have one student in particular who's in 3rd grade now and has actually never attended school. We have always provided medical homebound because he has such medical conditions that a common cold, a sniffle, could be terminal for him. So we have a teacher that works for him. I have another student, y'all, this breaks my heart. He's one of my littles. I mean, he was perfectly normal. He did great. We were integrating him into kindergarten, like he was in self-contained. He was ready to go. And then all of a sudden, he got this mysterious illness, and now he's in a wheelchair. Like, he can barely talk. Like, it breaks my heart every time we see this little guy, because we were like ready to let him go. And he's had a total 360. And now he's on medical homebound because, again, he's another one. Any little sniffle or anything can cause extensive absences. Mr. Hurley, I know this is a population, especially the medically fragile, that you work with.
Yeah, I have 3 students that are currently being served on hospital homebound.
Yeah.
And they've been on hospital homebound since, I think, 4th or 5th grade, and now they're getting ready to graduate in 2025 when they turn 22. I had one student who was on medical homebound for short term and during middle school and the first year of high school in 9th grade, and then finally has come to me, and this is her 2nd year being back from hospital homebound. So yeah, medically fragile to the max. And so yeah.
And listen, kudos to you, Mr. Hurley, because those students, the medically fragile and serious other health impairments, are the ones that are actually, I really have to put myself out of my comfort zone, because they I don't want to say scare me, but they make me the most nervous. Now, you give me a kid that's going to throw a chair at me and cuss me out, I am there 100%. Like, bring on those kids. A medically fragile student, yeah, that makes me nervous, because I just don't know. Yeah, sometimes you're afraid to touch them because you're like, if I touch you,
thankfully, I know. Thankfully, I have the parents, guardians are amazing. Their service provider has been with them since elementary school, so we kind of like share like a dual role there, where I work with their service provider and doing things, checking in, and of course we still have to, y'all have heard, progress monitor, all that stuff. So thankfully, knock on wood, I can't complain that I've had great support.
Yeah, those scare me. We did have 2. So my first year in this district, we had a student pass away. That was on medical homebound from a serious medical, and that's always awful. For any district, for anybody, obviously a loss. But unfortunately, that is part of, with medically fragile students, that we do see sometimes. And just like,
I've had 4.
Yeah, it's heartbreaking. And just like Mr. Hurley was saying, like the family's reaction. So the student's individual's personality really is a reflectiveness of like their family and others' reactions and how the public sees them. If we treat it as normal, the kids usually are okay. It's when you get the big gasp and things like that you see other things. But if you just treat it as normal, and they're people too, and it is what it is, they usually do fine. And the family's reactions are usually a reflection on how others react. Parents with individuals like this, especially medically fragile, we have to understand that they're very vulnerable. One, because of what's happening with their child or family member, and also because, they've had family reactions or other people's reactions. So they're dealing with multiple things coming at them. But some of these children are the sweetest children out there. And I wouldn't change it. So there are some other things you might see, some prosthetics, some artificial replacement. So like if an individual, you guys have seen these, if someone loses a limb, they have a prosthetic leg or arm or things like that. All of that has come a long way over the last years too. Orthosis, so that enhances some partial function. There are some adaptive devices that can be used. So things to consider, we really want to maximize their functioning. And of course, the affordability of technology, right? It's very expensive for families. Insurance may cover, may not cover, Medicaid may kick in, it all depends. But all of that technology and those cool things that are out there are extremely expensive. I know growing up, we had a TV show called The Bionic Man, and then we had The Bionic Woman, where, they had all these different parts and stuff. But all of that costs a lot of money. So there are students and individuals who don't have that because the families just simply can't afford it. And then of course, evaluation and availability of those things. And is it really going to help the individual or not? But we have some students that have some cool things. So some educational things to think about students with physical disabilities. It's not so much of the instruction, right? So your instruction is going to be your instruction. It's really more of educating the non-disabled individuals. And of course, obviously environment, we got to make sure all of those ADA compliance things and we have everything we need for a child with physical disabilities. But again, like we said, most students with physical disabilities intellectually are usually fine. It's just this physical part, or their cognitive is not so low functioning. We do have some that are both. But really, it's more about educating everybody else on them. So just like everything else, we have our individual plans, our IEPs, our family service plans for our students who are in private or homeschool. And then educational placement. Mr. Hurley and I both kind of talked about homebound for those medically fragile students. And not only the homebound for special ed, but also homebound if they're in general ed, right? We have to provide them that education as well. It's not, I have to remind principals all the time that it's not just special education services. If a student's medically homebound, they also have to receive the general ed services as well from a certified general ed teacher. So sometimes it's not the same teacher. Sometimes we send 2 teachers to your house or to work with a child, just depending on the situation. So some things to consider and think about. So some might be deprived of experience other has, especially if they're medically homebound. Obviously, they're not going to have the interaction, their social skills, things like that are going to be heavily impaired. It might be very hard for them to manipulate materials or things, hands-on stuff in typical ways. So we have to be creative and think outside the box on how they respond to things. And then for those who do have those severe disabilities, your goals really for that student are going to be more functional, right? What do they need to survive, to adapt to life? Not to say they're not going to learn academics, but they're not probably going to be learning algebra. They're going to be learning how to navigate their environment. They're going to be learning maybe, how to feed themselves, things like that, more functional life skills. And then they often, sometimes they do have other disabilities, and we do have other service providers, OT, PT, orientation and mobility, things like that, to work with those students. So some early intervention, just like everything else in special education, early identification is key, and intervention. This gives a much better prognosis, much better progress overall. In the meantime, of course, obviously those communication skills. So a lot of these children often receive speech and language therapy as part of their program. And then there have to be some special skills sometimes in our schools. Our occupational therapist is very good about this. If we have children in wheelchairs, and our physical therapists, they teach the teachers how to handle the child if they have to be picked up, carried, how to position them. I mean, we have all sorts of, and I'm sure Mr. Hurley does too, we have all sorts of equipment, standers, walkers, all sorts of things for the students so they can get some practice moving and walking. but we have to make sure they have the proper equipment and our teachers are trained on it. Looking at their gross motor, their fine motor, and all of that is taught within the context of daily living and social skills. So for us, it's obviously taught in classrooms, in the school environment, just navigating up and down hallways, navigating around the classroom, things like that, those functional skills they need to survive in a school setting. So transition, so not just to adulthood, but we also have transition for these students from hospital settings, either back to home, school, or work, right? So we're not just talking about our typical transition where we're transitioning out of high school. For these kids, it could be transitioning from hospital settings. And, you know, again, just like every child, we want to look and prepare them for the future. So, you know, for our physically disabled, we want to help them choose a career where they can do things, right? Where there are jobs that they can do. Our laws have improved greatly for accessibility and accommodations. You guys saw some of that with your ADA technology. We do have supported employment out there, voc rehab. Lots of agencies will go out and support these individuals in actual job settings. You know, and then you have your social attitudes, and you know, these students, like anybody else, have a right to an education and a full range of experience. Just because necessarily they have a physical disability shouldn't keep them from the same experience that everybody else has. There are a lot of college programs out there. You guys know there's Clemson Life. USC has a program. I just learned Winthrop has a program. So there's a lot of programs out there for students like this too. That was a lot, but any questions on physical or other health disabilities? It's fairly straightforward. Have you guys had any experience with any individuals or anything with physical or other health disabilities? Anybody? Bueller? So Hurley, you laugh, so you know what movie that's from.
Very much.
Well, if you haven't had experience, chances are in your teaching career or in the future, you definitely will. So now you know a little bit about them and things that you can do. So let's talk the flip side. We are moving quickly, but part of that is because it is the last class and there's not a whole lot more left. And these two topics aren't as heavily involved as some of the other ones have been. So we're going to move through this and probably gift you guys back some time. But let's talk about learners with special gifts, otherwise known as our giftedness, or what you would hear as gifted and talented students. So some issues affecting some considerations of individuals with giftedness, right? So in what way should they excel? How are we measuring it? Why should students be identified? These are some things that everybody's kind of talking about when you're looking at individuals with gifted and talented and a disability. So like I said before, those are called twice exceptional individuals. We do have individuals who have maybe a specific learning disability in some areas, but then are very gifted and talented in other areas. And I think we're seeing more and more of this. So not only do they receive special ed services, but within the same point of the day, they're receiving services in gifted and talented. An example might be like an individual with autism. So they may be identified with autism, but they're very gifted and talented in, let's say, in math, that's their strength. So they receive gifted and talented services because their math, abilities are excel. So oftentimes, I know in my district, I'm the director of special services, not just special education. So I did at one point also do our gifted and talented program. This year I kicked it down the hall because I picked up a bunch of other stuff. But you will oftentimes see that, and I kept telling them, like, y'all, I'm in two different worlds here, right? I'm dealing with disabilities, and then I'm trying to figure out, how to excel others. But really, this is just some terminology that you'll see surrounding gifted and talented. And really, the kids are superior, the individuals are superior in certain areas or in all areas. Oops. So some common features, they often have a high intellectual ability or IQ. We're looking at specific aptitude tests. These are individuals who do really well on state tests and things like that. We do look at their creative thinking ability. Some have advanced skills in fine or performing arts. So they could be gifted and talented in the arts, not just necessarily in the academic realm. And then we do see a high potential for leadership. These students too, in my opinion, and Mr. Hurley, let me know if you have a different one, often are students who are gifted and talented are often what I like to call quirky, right? So much like our students with autism, they don't have social skills. Sometimes our students who are gifted and talented, so, very superior, are often seen as kind of quirky, and, their social skills are a little bit lacking too, because, they're so focused on what they can do. So this is just the criteria in South Carolina. I'm not going to go through all this. Y'all can read this later, but this is there's 3 dimensions in which a student can qualify for gifted and talented in South Carolina. So this is really what they are. So you have your reasoning abilities, academic achievement, and then your intellectual academic performance. So there are 3 criteria that a student has to meet in order to qualify for gifted and talented services in South Carolina. And they have to meet all 3. I'm sorry, 2 of the 3 they have to meet in order to be considered a gifted and talented student. So it's assumed about 3 to 5% of our population is gifted and talented. A lot of that is because of the definition. Every district, every state has different requirements. Kind of where this all begins. So there's some genetic factors. Again, there's theories about nutrition, neurological functioning, some of the social factors. Family, school, peer groups, communities. I've heard theories where you have really intelligent parents, so they have really intelligent children, like engineers and scientists and PhDs. I mean, I have a PhD, but I love my daughter, but she's an average Joe. I'm certainly not gifted and talented, and that's okay. But those are all kind of factors that they feel like lead to a student to be identified as gifted and talented. Oops, I'm like trigger happy today. It's crazy. So some of the things, like the features of the family, again, from research, for highly successful people, there's, the family has a real interest in their child's talent. Like we just kind of talked about, the parents were their role models. Specific parental encouragement and reward for doing these things. Expected behaviors and values related to the talent. Teaching was informal in many settings. So there are lots of things happening. Early tutors and mentors. Parents were observed, during their practice, instruction rewarders. They sought, oftentimes parents will seek their special instruction, and they really encourage their students' participation in public events. So students who are gifted often have parents behind them really pushing a lot. So when we look at identifying gifted and talented, again, I know this is the total opposite of spectrum of what we talked about all semester, but it is important because we do have, like I said, duly identified students. But again, we're looking at IQ tests, standardized achievement scores. In South Carolina, your teachers or your parents can nominate a student for gifted and talented. Peer self-nominations when you get to the high school level. And really evaluation of work or performances. So there's a lot of things that go into play besides just those dimensions as well in order to be identified as a gifted and talented student. So there's 3 things that education should have. So we want to make sure that there is a curriculum designed to accommodate those advanced skills, right? There's a lot of differentiation going on, instructional strategies. We don't want these children sitting in a classroom being bored who are gifted, because then typically what will happen is we'll tend to have behavior problems then because they're bored. Some students who are looked at for behavior problems, we later find out, we evaluate, and well, heck, they've got an IQ of like 120 or 125 or 115. And we're like, well, he's bored. The child is bored in centers and doing ABCs. And, once we up the rigor of the classroom, the behavior starts to go away. And then really appropriate grouping. So making sure instructionally when you're working with these students, you don't, that you have them grouped appropriately and you are challenging them, right? It is hard. So as a teacher, you'll have your low groups and then you'll have your high groups, and your high groups are the hardest because there's so much that they can do. It is much easier to move a lower functioning child, or I don't want to say lower functioning, but a lower achieving child. It's much easier to see that gap close quicker than it is for a very high achieving student. Those students are very hard to see the needle move a lot because they are so intelligent. But there are programs, acceleration, enrichment. I know in our schools we have programs for them, they meet, things like that. So lots of things to encourage that giftedness. So what are some barriers to the early intervention? So a lack of parental advocacy. Some parents don't realize a lack of teacher training, right? Our 4-year-old teachers or 3-year-old teachers don't often know that they have a child who may be gifted or doing accelerating things. They emphasize other students with ability, right? So it's your average child, your low child, and then your gifted child. Sometimes it's the gifted children who kind of get lost in the shuffle because they can do so much and they don't require a lot of attention. Sometimes there are financial constraints for the family or schools to be able to provide things for them. There are laws preventing early admission to school. I mean, you have a gifted 5th grader, there's laws preventing him from going to college. But I'm sure there are some out there that are probably in 5th or 6th grade and ready to hit a college classroom. And then sometimes you do have your refusal to accelerate. So, you know, as a school district, you know, we look at socially appropriate too. Is it appropriate to, let's say, have a 5th grader, you know, pushed up to 7th or 8th grade because intellectually they can do it, but size and social and all of those things, that child's not ready. So that's where all those enhancement and enrichment programs are so important. So those are some barriers to really moving that child is even quicker. So again, that transition, we're really looking at, we tend to be aware of their strengths and their weaknesses. They may need personal career counseling. Acceleration versus enrichment. So early interest into college appears to be effective. So there have been studies and stuff to show that gifted children, if they get early entrance into college, that's a great transition. And then to make sure, like I said, they're kind of those quirky kids. So we want to make sure that we're paying attention to their social and personal development, right? They kind of get in their lane and forget about sometimes basic things like, hey, I gotta remember to take a shower, those type things. Any questions? Woo, we worked through that quick tonight, y'all. No questions? We got nothing. We are definitely getting out of here early tonight. Okay. Bueller. I mean, again, there weren't a lot of activities with this. It was pretty much just kind of sit and get so we can get through these last two. And they're really self-explanatory, the physical, other health, and then gifted. It's not as convoluted as children with autism or intellectual disabilities or things like that. These are fairly straightforward disabilities. All right, so as we do that, let's talk about your final exam. Here's the exciting thing. Okay, so your window is next Monday. Now, I have it set to open at 12 o'clock. If you want to unmute or voice an opinion, I don't have a problem opening it up earlier on Monday if you all would like. I mean, I can open it at 8 o'clock if you want to have all Monday to do it, but you only have to 11:59 Monday to do it. So I need you all to voice your opinion either in the chat or just plead your case for it to be opened early. I'm even willing to open it up Sunday and give you basically a day and a half to do it if you think you'll need it. It is open book, open notes. It will not be on lockdown, so you're free to use your internet. So we have made it a little bit more flexible. This final exam is 50 points to your grade, so you are going to want to, do fairly well on this. There are 50 to 60 multiple choice questions. There are 3 to 5 discussion questions, and there's 1 or 2 vignettes. There is 1 extra credit question. You do have to complete it in 1 sitting. So once you open it and start it, you have to finish it. You can't open it, start it, walk away, things like that. It's not timed, but you do have to open it. You do have to do it in 1 setting. Now, the only thing I do ask, I shouldn't say we do ask, this is not a group final exam. So don't get together with all your friends in the class and take the exam together. We're going to take you on your honesty here that you're not going to do that. You are allowed to use your resources. I did take the lockdown off and all of that. But you just really, you have to somewhat do it as if you're sitting in the classroom. So, you wouldn't be in a group discussing a final exam in a class. So we're going to take you on your honesty that you won't do that. It's kind of hard when we're online and we're not there. So I see a couple here, Mr. And really, guys, just review your summaries, your notes, the recordings, the handouts. Again, nothing should be a surprise. It's very similar to the quizzes, so there's no real surprises. My recommendation, and I'm sure Mr. Hurley's too, is to make sure you read each question carefully. On some of the quizzes and stuff, some of you got stuck because you read quick and you didn't read the full question, so you lost some points. And I appreciate you all asking and trying to justify, but when I pointed out, well, that's not what the question said, you're all like, oh, right. So just make sure you read the questions carefully. Don't rush to do this. It really shouldn't take you more than 2.5 hours. If it does, that's fine. But I think you guys should, based on your quizzes and everything else, you all should do fine on it. So I've got a couple requests for Sunday. Let me stop recording here.